The world is no stranger to infectious diseases. From the flu to more severe outbreaks like Ebola, we've seen how these invisible enemies can disrupt our lives. We've seen how quickly outbreaks can escalate, impacting lives and overwhelming healthcare systems. Hospitals become battlegrounds, and medical staff are pushed to their limits. The Marburg virus, while less known than some, poses a significant threat. This virus, a close relative of Ebola, is equally deadly and requires our utmost attention. This deadly disease, with its high fatality rate, demands our attention. The symptoms are severe, and the mortality rate can be alarmingly high, making it a critical public health concern. Understanding the virus, its transmission, and the protective measures we can take is paramount. Knowledge is our first line of defense against such a formidable foe. We must be vigilant, informed, and prepared to combat this silent threat. Public health campaigns and community preparedness are essential in mitigating the impact of the virus. This knowledge empowers us to protect ourselves, our loved ones, and our communities. Simple measures like wearing masks, practicing good hygiene, and staying informed can make a significant difference. The Marburg virus, a member of the filovirus family, causes a severe, often fatal hemorrhagic fever. Its structure and behavior under the microscope reveal the complexity and danger it poses. Its impact is swift and devastating, often leading to multi-organ failure and death. The emotional and physical toll on patients and healthcare workers is immense. The virus, first identified in 1967, has periodically emerged in various parts of the world, leaving a trail of fear and uncertainty. Each outbreak serves as a stark reminder of the virus's potential to cause widespread devastation. While outbreaks are not as frequent as some other diseases, their severity demands our unwavering attention. Continuous research, global cooperation, and preparedness are key to preventing future outbreaks and minimizing their impact. Marburg virus disease, previously known as Marburg hemorrhagic fever, is a rare but highly contagious illness. It was first recognized in 1967 when outbreaks occurred simultaneously in Marburg and Frankfurt in Germany and in Belgrade, Serbia. The outbreaks were linked to laboratory work using African green monkeys imported from Uganda. It primarily affects humans and non-human primates, causing severe illness and, in many cases, death. The disease is marked by sudden onset of fever, chills, headache, and muscle aches, followed by severe bleeding and organ failure. The virus, named after the German city where it was first identified, belongs to the same family as the Ebola virus. Both viruses are members of the Filoviridae family, known for their filamentous structure and severe pathogenicity. Both viruses are known for their ability to cause severe hemorrhagic fever, characterized by bleeding, organ failure, and a high risk of death. Symptoms can appear anywhere from 2 to 21 days after exposure, making early detection and isolation crucial. The virus, a filovirus, is a single-stranded RNA virus. Its genetic material allows for rapid mutation, which complicates the development of effective vaccines and treatments. Researchers are continuously studying the virus to understand its behavior and find ways to combat it. Its genetic material allows for rapid mutation, making it challenging to develop effective vaccines and treatments. Despite these challenges, progress is being made, with several vaccine candidates currently undergoing trials. Marburg virus is zoonotic, meaning it can be transmitted from animals to humans. The initial transmission often occurs through direct contact with the blood, secretions, organs, or other bodily fluids of infected animals. Fruit bats are considered the natural reservoir of the virus, and contact with infected bats or their droppings can lead to human infections. These bats can carry the virus without showing symptoms, making them a hidden threat. Once the virus jumps from animals to humans, it can spread rapidly through human-to-human transmission. This occurs through direct contact with the blood, secretions, organs, or other bodily fluids of infected people, as well as through surfaces and materials contaminated with these fluids. Strict infection control measures are essential to prevent outbreaks. The first recognized outbreak of Marburg virus occurred in 1967, simultaneously affecting laboratories in Marburg and Frankfurt, Germany, and Belgrade, Yugoslavia. This outbreak marked a significant moment in virology, as scientists scrambled to understand the new and deadly pathogen. The virus was named after the city of Marburg, where the first cases were identified. Researchers and healthcare workers faced unprecedented challenges as they worked to contain the virus and prevent further spread. The outbreak was linked to infected African green monkeys imported from Uganda for research purposes. These monkeys, often used in scientific studies, unknowingly carried the virus, which then spread to humans. The transportation and handling of these animals highlighted the risks associated with the global trade of wildlife for research. This incident underscored the need for stringent biosecurity measures in laboratories and research facilities. Subsequent outbreaks have been reported in various African countries, including Uganda, Kenya, Angola, and the Democratic Republic of Congo. Each outbreak brought new challenges and lessons, as healthcare systems in these regions struggled to cope with the high fatality rates and rapid spread of the virus. The recurring nature of these outbreaks emphasized the importance of ongoing surveillance and research to better understand the virus's behavior and transmission. The largest and deadliest Marburg virus outbreak occurred in Angola from 2004 to 2005. This devastating outbreak overwhelmed the healthcare infrastructure, leading to a significant loss of life. The rapid spread of the virus and the high mortality rate created a sense of urgency among international health organizations, prompting a coordinated response to contain the outbreak and provide support to the affected communities. This outbreak, centered in the Uyghur province, resulted in over 250 deaths, with a case fatality rate exceeding 90%. The high death toll and the speed at which the virus spread highlighted the critical need for effective public health interventions. Memorials and grave sites in Uyghur stand as somber reminders of the lives lost and the impact of the outbreak on the community. The outbreak highlighted the challenges of controlling the virus in resource-limited settings, emphasizing the need for robust public health infrastructure and infection control measures. The lack of resources, including medical supplies and trained personnel, made it difficult to manage the outbreak effectively. This situation underscored the importance of international support and collaboration in addressing such public health crises. More recently, outbreaks have been reported in Ghana and Guinea, underscoring the virus's continued threat to global health security. These recent cases serve as a reminder that the Marburg virus remains a significant concern, requiring ongoing vigilance and preparedness. The global health community must remain committed to monitoring and responding to new outbreaks to prevent further loss of life and to protect public health. Understanding how the Marburg virus spreads is crucial for effective prevention and control. The virus is not airborne but spreads through direct contact with infected bodily fluids such as blood, saliva, vomit, urine, and feces. Contact with contaminated surfaces or materials like bedding or clothing can also lead to infection. Healthcare workers are at a heightened risk of infection, especially when caring for Marburg patients without proper personal protective equipment. Unsafe injection practices and burial rituals involving direct contact with the deceased can also facilitate transmission. It's important to note that individuals infected with the Marburg virus are most contagious during the later stages of the disease when hemorrhagic symptoms are present. Section 5. Recognizing the signs and symptoms of Marburg virus disease. The incubation period for Marburg virus disease typically ranges from 2 to 21 days. This is the time between exposure to the virus and the onset of symptoms. Initial symptoms often appear suddenly and can be nonspecific, resembling those of other viral illnesses. These early signs include fever, chills, headache, muscle aches, and a general feeling of malaise. As the disease progresses, symptoms become more severe. High fever, severe diarrhea, abdominal pain, vomiting, and unexplained bleeding or bruising are common. In severe cases, patients may experience jaundice, pancreatitis, delirium, seizures, and multi-organ failure. The hemorrhagic manifestations of the disease, often seen in the later stages, can be particularly alarming and contribute to the high fatality rate. Section 6. Protecting yourself and others. Prevention is key. Preventing Marburg virus infection relies heavily on avoiding contact with infected individuals and contaminated materials. If you live in or travel to areas where Marburg outbreaks have been reported, take extra precautions. Avoid contact with fruit bats and their habitats, as they are the natural reservoir of the virus. Practice meticulous hand hygiene by washing your hands frequently with soap and water or using an alcohol-based hand sanitizer. Avoid contact with bodily fluids from sick individuals, especially those experiencing fever, vomiting, or bleeding. If you are caring for a sick person, wear appropriate personal protective equipment, including gloves, gowns, masks, and eye protection. properly disinfect contaminated surfaces and materials using bleach solutions or other approved disinfectants. Section 7. Managing Marburg treatment and supportive care. Currently, there is no specific antiviral treatment approved for Marburg virus disease. However, supportive care plays a crucial role in managing the disease and improving patient outcomes. This includes maintaining hydration through intravenous fluids, managing symptoms like fever and pain, and providing oxygen therapy as needed. Experimental treatments, such as antiviral medications and antibody therapies, are being investigated for their potential to combat the virus. However, these treatments are still in the research phase and are not widely available. Early diagnosis and prompt initiation of supportive care remain the cornerstones of managing Marburg virus infection. Section 8. The race for a cure, vaccines and research advancements. The development of a safe and effective vaccine against the Marburg virus is a top priority for researchers worldwide. Several vaccine candidates are currently in various stages of development, with some showing promising results in preclinical trials. These vaccines utilize different platforms, including viral vectors, DNA vaccines, and protein subunit vaccines. One promising vaccine candidate, based on a recombinant vesicular stomatitis virus (RVSV) vector, has shown high efficacy in protecting non-human primates from Marburg virus infection. Clinical trials in humans are underway to evaluate its safety and effectiveness. The development of a Marburg vaccine is crucial for preventing future outbreaks and protecting high-risk populations, including healthcare workers and individuals living in endemic areas.